We good.
Doing
Good
well.
evening, good evening, good
Sounds like
evening, and
you're
welcome
doing
to
all right.
Conversations with the Doctors, where health is
I
wealth. What
like
night is
that
it tonight?
shirt you're wearing, Dr. Miller. I'm gonna get me one of
Brighten
these
things up a
like
little
that
bit.
so I can be
What
seen.
night is it tonight? It is Monday night, and it is time for Couch Conversations with the Doctor. So remember to and share again, and invite your friends in to pay attention. We want to make sure that we remind you that in June is Men's Health Month. And of course, the guys always say that we forget about them, but our whole focus in the month of June is on the men in our lives. So Men's Health Month is June. So it is Friday night, and it is time for it's Monday night, and it's time for Couch Conversations with the Doctors. As always, we're going to go around and introduce our esteemed panel guests that is here, starting with my colleague Doug, who tends to leave me and have fun in the sun. But guess what, Doug? It's 90 degrees in Chicago today.
Yeah, no, and I haven't had either much fun or much sun, so I wish I was there. Good evening, everyone. I'm a retired physician. I worked in the western suburbs for 30 years, and then I joined the Congress Center in his office, and it really opened my eyes to public health and public service. It's a real honor and a privilege to be here, and we're going to try and answer your questions as best we can.
Outstanding. Thank you so very much. Well, to the man who says I threaten him to be here every Monday night, but he seems to always be on time. That's our very own Dr. James Miller. Dr. Miller.
Well, good evening, everybody. Glad to be with my esteemed colleagues today. I am a retired internist. I practiced about 40 years in Chicago and around surrounding suburban areas. Um, I'm so as I said, I've retired, so I don't do clinical medicine, but I'm still interested in healing our community. And there's a lot of healing that needs to take place. So we try to do what we can to inform people, to enable, to empower people, so that they are able to achieve the things that were created to achieve. So we're glad to be here with our guests tonight, and hopefully we can give you some information that's going to make your life brighter and better.
Thank you so very much. Well, to my brother from another mother, who is simply outstanding. And if you want to get your church on, don't be fooled by Dr. Kareem Watson, because he can get it crack-a-lacking when it comes to him and some Jesus. That's our very own president and CEO of our Miles Square Healthcare Centers, Dr. Kareem Watson. Hey, Kareem.
Hey, Nikki. Hello, Congressman. Hello, everyone. It's really an honor and a privilege to be here. It's even more of an honor and a privilege to lead the Miles Square Health Centers, where our roots and our history go back to 1967 on the west side of Chicago, where we are proudly one of the oldest federally qualified health centers. And definitely, we now have 11 sites, including 4 school-based health centers, and we are excited. We excited all year long, but we really do celebrate the month of June and Men's Health Awareness Month, and really bringing awareness to some of our amazing providers that we have at our sites, and eager to join in the conversation tonight. Thank you, Nikki, for having us, and thank you, Congressman, for even creating the space for this conversation.
Thank you.
Thank you so very much for being here. Well, we have someone who's here with us on tonight that is simply phenomenal, and I'm going to let him tell you all about himself. Come on, Mr. Trotter.
And me, who struggles a little bit with technology, I should be better at this. So, first off, I'm honored to be here, and thank you all for actually having me. And I am Sean Trotter. I am actually on the payer side of this discussion, and very excited about what this means to have a payer at the table discussing men's health. In addition to that, I just happen to be at my former stumping ground, Northwestern Medicine, right now. I remember doing a lot of work here on men's health for many years. And while I am still not officially that doctor yet, but Dr. Watson knows, he was one of the ones that made sure I got in my program. And so give it a couple of months and whatnot, and then I'll officially, put the stamp on this conversation and join these wonderful gentlemen as being Dr. Trotter as well. So I'm going to hold that truth to be true, and look forward to tonight's conversation on men's health.
Well, thank you so very much. Well, to the man that makes this possible for us each and every Monday night, to the one who teaches us that true wealth is our health. It's our very own Congressman of the Illinois 7th Congressional District, Congressman Danny K. Davis. Congressman?
Well, thank you very much, Nikki, and thanks to all of those who have joined with us. And Nikki, let me just begin by congratulating you because I've had a whole family who've been calling me. They're two little girls. They're not African American. As a matter of fact, their grandfather and I used to serve together in the Chicago City Council. One had an illness as they were growing up, and they are his granddaughters. And they saw a photograph when they were young of me and George. George and I used to alternate saying the invocation when we were in the city council doing council wars. One week I would give the invocation. I was part of the 21. The next week, George would give the invocation. And he was Armenian. And he used to say that he was from the smallest minority. And we used to talk a lot. But his granddaughters both decided to go to medical school and they both finished and they're both and one of their husbands. All three of them are young physicians, and one was ready to do her work and all, and somehow her license were stuck and hung up. And Nikki was able to go through all of the tape that the licensing board in the state of Illinois operates and get her license in term for her to start her residency at the anointed time. And so they've all just been calling me saying, oh, this lady who worked with you named Nicole Harvey, she's the best in the West. And I say in the North and the South and East and the whole works. And at the same time, she was going through the transition of her aunt, and all of that has happened. But Nikki, they congratulate you on the outstanding work that you did on their behalf. I'm going to do the same thing, and we appreciate the fact that you were able to assist them the way that you did. So thank you very much. Well, we're all set and ready to go. As a matter of fact, it's good to have this esteemed panel. Every time I think of Miles Square and I go over there on Roosevelt Road, where they sit in about a $20 million building, and I think of when I first met them, they were in a two-story building or two flat on Washington Boulevard, first floor, second floor. And from that, they have grown into becoming who they are, and what they do with many clinic sites in Chicago and even with the clinic in Rockford, Illinois. And they continue to be, as Dr. Watson just said, a role model of a health center for many of the centers. There were 10 in Chicago. I mean, 10 in the country at that time. Three of those 10 were in Chicago. Now there are 1,400 of them in the United States of America, providing quality health care to 30 million residents, 30 million people or so. So things have come a long way, and notwithstanding the fact that we are shaken, that we're nervous about the big, beautiful bill that has a great deal to do with funding healthcare, especially, and the large amount of money that is being reduced from Medicaid, as well as from all kind of other things. But the Medicaid reductions scares to death. Because if those hold, look out Mount Sinai, look out Humboldt Health, look out a number of safety net hospitals throughout the state of Illinois and across the country. There will be so many rural hospitals closing in rural America until it ain't. So we still just had Father's Day. We still have Men's Health Month. We still have all these good things that are going on. So, Nicole, why don't we just get it on, as the blues singer would say, and get started?
Well, well, outstanding. I want to say hey to Diane Alexander, who is here from the Alzheimer's Foundation, to Jackie Glass from Heart Grove Hospital, who is here with us just as well, to Doreen Marlowe,
Just
who is here
over
with
there Sunday.
to Pastor Upindo Parker and his mom, Rose Parker, who are chiming in, and they are here saying, we're ready for the conversation. So I want to say hey to Juan Teague, who is here with us just as well, to Betty Johnson, who is here with us. Also to Deborah Williams, who is here with us on this evening. Hey, Deborah, how are you? Tawana Calvin is here. Diane Knight Lewis is here with us just as well. Men and Women of Excellence. She's here with us. I want to say hey to Alderman Pet Dow, who is here with us, and also to President Carrie Steele, who is here with us just as well. I want to say hey to Linda Johnson, who is here, and she says, good evening to everyone. And thank you so very much, Linda, for your condolences. For those of you who are asking about Dr. Green, she is actually out of town, but she will definitely be back on next week. She will definitely be here on next week. I want to say hey to Roderick Watson, who is here on Instagram saying the men are in the house. I want to say hey to Jackie Robinson Ivy, who is here with us just as well. Hey, Jackie, how are you? We are glad that you are here with us. Defonda Louis says, come on with the men's conversation. He is so glad that we did not forget about the men. To our gentlemen who are ganged up in the garage over on Van Buren Street watching on the big screen TV, we want to say hey to you guys. We know you're here. To the Core Center, who is here. Yes, they are working, but they are also watching. I want to say hey to Karen Scott, who is here, and she says good evening to everyone. Well, Kareem, why don't you start us off with the men's health conversation? Of course, you know I'm going to be jumping in and out, but I know you guys got it. So why don't you get us started? And Dr. Miller and Doug and everybody else will chime right on in.
Thank you, Nikki. As the congressman said, we are really excited at Miles Square to be partnering with my partner in purpose. I don't say partner in crime, I say partner in purpose, Mr. Sean Trotter from Aetna Better Health. We're excited that at Miles Square, we've always had a commitment to ensuring that we support all populations across the life course. And we are having a new special effort to ensure that we're addressing men's health across the life course. And we say across the life course, what we mean is men from the time that they are born, babies, all the way to adulthood and older populations. We're thinking about our pediatric population as well as our Medicare population as well. And with the month of June being Men's Health Awareness Month, we're excited to be kicking off conversations with certain populations who have been underserved and marginalized. And so I'm going to ask my partner in purpose, Mr. Sean Trotter, to come off of mute in a second to talk about an event that we have coming up actually this Friday, Friday, June 20th from 11 a.m. to 1:30 p.m. at our Auburn Gresham Clinic located at 839 West 79th Street. We are inviting you to join us for a conversation about care and well-being for successful reentry. Now, we know that one of the things we're proud of at Miles Square is that our community clinics are located in zip codes that serve some of the most underserved populations in the state and in the city. And as a result of us often being in these community areas and these zip codes, we also know that these zip codes and community areas often are home to a population that may be returning from having justice involvement. And we want to remove the stigma, remove the judgment, remove any negative thing that comes along with that reentry population, and make sure that we're developing a care coordination model that can meet populations, men and women, but particularly we're focusing on men for this month who have been justice involved to ensure that they can come to our Miles Square Clinic. We can become their medical home, connect them with the social services resources that they need to successfully re-enter into the population and get the health care that they deserve and need. Mr. Tribe, do you want to talk a little bit about why Aetna Better Health partnered with Miles Square, as well as Task and the Greater Auburn Gresham Development Corporation? Shout out to Carlos Nelson at Greater Auburn Gresham Development Corp and our partnership with Carlos. Sean, do you want to talk a little bit about Aetna Better's Health, your commitment to this work as a payer?
Absolutely. The opportunity actually to partner both with Mile Square, Task, Safer Foundation, and of course, Carlos at Greater Auburn Gresham Community Development Corporation. This right here was an opportunity that, well, I will say is long overdue, but more importantly, just an opportunity for us as a payer to actually begin to really highlight exactly what that population means within our mix of patients. I think for a number of us, we don't necessarily think of the insurer as being a key partner in the discussion around justice involved in reentry. However, what we do know is that a number of our members might actually have those backgrounds that they might not necessarily put as their first check on how they identify, but it does create a burden or a barrier to them receiving adequate care and timely care depending on how they actually navigate the system. I think the great thing about Friday's event and partnering with Mile Square, it is that unique intersection where there is direct care being brought into the discussion, as well as for us, case management, appropriate use of value-based benefits, and just knowing all of the different options that are actually in play that they might not necessarily be aware of or that they actually know is made of a service for them. And so the opportunity to partner with Mile Square, again, as Dr. Watson just mentioned, is, of course, their view on how they can actually enhance these opportunities to inform the community about the services they provide, or for us to also come in and highlight where there are programs and services that actually do help them navigate the system from the payer perspective, or rather from the payer opportunity that we actually present to members within our plan. And so really looking forward to this discussion to really highlight some of the existing partnerships that are currently out there that do address a number of issues. And we're not just talking about, physical health issues. We are also talking about behavioral health and having a pathway to care that we really do want to make sure these individuals do know they get.
Thank you for that, Sean, and it's so important. And I'm, as some of you may know, I'm trained as a cancer disparities researcher, and I must admit, I spent a lot of my time, Congressman, learning about prostate cancer from one of my mentors, Dr. Terry Mason, and learning about the importance of prostate cancer screening. But I was surprised when I learned that lung cancer was actually one of the top cancer killers of African American men. Lung cancer actually has a higher mortality death rate than prostate cancer. And one of the things we know is that oftentimes, particularly our population who's been justice involved, and even our veterans, oftentimes have tobacco addiction, not because sometimes we know tobacco is one of those products that can be used in place of, to address mental health needs, to address anxiety and untreated depression, untreated PTSD. So really excited that by partnering with Miles Square, we also get to address the behavioral health, including mental health, screening for anxiety, depression, and even oral health. Because as we think about tobacco, we also think about the increase that causes for things like head and neck cancer, in addition to lung cancer. And so, in this conversation we're going to have on Friday, again, that's this Friday, June 20th, from 11 a.m. to 1:30 p.m. at our Auburn Gresham Healthy Lifestyle Hub, located at 839 West 79th Street. We are going to be talking about how can we create a care and well-being model to support populations who have been justice involved. So I want to now kick it to Dr. Miller and Dr. Doug to talk about some of the things that you all have seen in your careers as it relates to some We're going to, I know later on, you all going to talk about more holistic health with men's health in general. But when we think about the population, Dr. Miller and Dr. Doug, who've been justice involved, and we use that term justice involved or involved in the criminal justice system, even as a way to remove the stigma of saying someone was formerly incarcerated. We now are thankful that our language is evolving to give dignity to that conversation. So, Dr. Miller and Dr. Doug, do you want to share your experiences in taking care of populations who may have been justice involved? We'll start with you, Dr. Doug.
Yeah, I'm just going to say that um, in my practice setting, that was not something that we encountered very frequently, except in the hospital setting.
Mhm.
But I clearly understand the message that you're saying is that every human being deserves to be treated with dignity, and care should not be withheld or modified because of a label or of an experience. And I don't know that how you can perform your job as a physician without the experience of empathy and understanding of the circumstances and focus on the illness and not the other things that were brought into the hospital as well.
Thank you for that, Dr. Doug. One of the things we found is that many of the populations actually receive good care while they're actively justice involved. They're often seeing the primary care doctor, they're getting treated. But when they leave, particularly if they have a chronic condition, they may leave the justice system without having the appropriate access for high blood pressure medications. Diabetes is a big one that we're seeing, even liver disease, and some people are living with other chronic conditions. Dr. Miller, do you want to talk about your experience in
Yeah,
ensuring?
I think that I always tend to, when I look at people who have health issues, I try to look at where things started at and how they maybe could have been changed and why they evolved into be what they are. And so, oftentimes, my experience has been that oftentimes people who have been involved with the justice system. Uh, when they came to my attention, many of their disease had been there for some time, had caused some in-organ diseases, and so when you have these extra problems of your body having been damaged and your organ system having been damaged by whatever disease process that you are suffering, that then becomes a more difficult chore for that individual to live with. But yet and still, they still have to. We still have to try to get them through this and figure out what it is that they need. For instance, oftentimes, I would see a patient, instead of them just having mild to moderate hypertension, they had hypertension and some liver damage. I mean, some
That's
kidney
right.
damage. So now we're dealing with an extra problem that is a significant that has a significant effect on their life, and which is also, we have other requirements in terms of dietary changes that they need to adjust in order for their disease process to be controlled. So also adding all these additional things, and again, based on what their lifestyle and not just lifestyle, but what their lives had been and the things that had impacted their lives caused, and the damage that it caused. And like I say, we've had some discussion, as we've had discussion about men health. We often start talking about what make a man. You got to start with a boy. You
Mm-hmm.
start out as a boy, and I always, my grandma, when I was I lived with my grandma for a period of time, and I was the stirrer. She gave me the spoon and she would put in the ingredients and I would stir. And so one day I said, Grandma, let me cook this cake. Well, I really didn't know exactly what should go in. So, I thought I had it, down straight, and I had memorized and what it needed, but I didn't. And so what I really learned is that without the ingredients, you can't have a good outcome or a good product. So, and oftentimes these are the things that we are often finding with men in certain communities, and men in life situations that have altered and cause them to have some hardship, is that they don't have all the necessary things to be able to live that life that everybody wished that they could have. We want the right education, we need the right health care, we need the right diet. All these things are very important in themselves. Each of them are important. And so when you try to put together, when you look at that person and something or some things are missing, that's going to show up in some kind of way. And so those are the kinds of things that I did experience. And so my process is not just to control their blood pressure, but to look and to help them to understand, you missed some stuff here. So we got to do some things about how to fix that, and to never forget the fact that you have these other issues that have that came from you having high blood pressure, but has now evolved into you having some kidney damage. So that's going to change it. That you're going to have to be careful about the salt now, more so, even more so than you were before. Even though you probably always should have, but now it's become it can become a bigger problem that you won't be, that your body just has been damaged and it won't be able to manage it. So those, so those are the kinds of things that the problem that I encounter with dealing with that particular population. In addition to them just making life adjustment, I think that's a problem for most people, making
Right.
life adjustment. And in today's time, it seems like this adjustment thing is coming much faster than it used to come. You
Yes,
know what I'm saying? It
I
seemed like in
do.
the past you could make a mistake and nothing bad happens, but you make a mistake now, and yeah, we say our young men suffer injuries or even death from that. So the adjustment that you have to make is they're big and they have to be swift. So
Mm. Thank you for that. Mr. Trotter, before we come to the congressman and talk about some policy ch- things around this topic, as the payer and the Better Health, well, why are you all at the table for this conversation, Sean? And even in your experience and your research, I know around populations living with sickle cell and other chronic conditions that you study both as a researcher, but also in your current role, why do you see the importance for the payer being a part of this conversation?
Yes, absolutely. I think first and foremost, as you mentioned in the beginning, that we wanted to really look at this life course strategy as we are really being deliberate about men's health. And as we are talking about the justice involved, we are looking at it from every level. So, first, it's not just that individuals who are currently incarcerated who might be getting returning, but we are also looking at those who might have early court assignments, juvenile justice, anyone who essentially might have a touch point with law enforcement. And we are talking about pretrial as well, so jail, and looking at all of that, in particular, how it actually impacts a member in our plan. We know that with youth, particularly youth who might be in foster care, the rate in which they might engage with the justice system is actually higher than we would say individuals who might be commercially insured and with whole families. We also see that with individuals who might have addictions, that their treatments with courts and things of that sort, that they might not be assigned to prison or jail, but they might get MAT assignments for which we are covering their therapies and all of the aligning health issues that they might have. And then the other important piece, of course, with the justice involved in them, that opportunity for which they might come back into a community is within that 90-day release period, they can enroll in coverage. And we want to encourage them to actually make a selection. So if they are transferring out of an institution, say with medication, or they need to do follow-up care, they have the appropriate coverage so that interoperability from the prison system into, say, a hospital system outside of this, that care has as much transition, as little barrier and hurdle that they can possibly get. And that is because we do have policies here in the state of Illinois that ensure that, again, your background doesn't prevent you from getting the necessary care that you need. And then more importantly, and you mentioned it, that in my own research and looking at it, the one thing I can say is that yes, there are individuals inside who end up inside correctional facilities that have chronic conditions that need to be maintained. In such case, such as sickle cell disease, they might not necessarily get the same adequate care that they would when they're out of the system and are able to go to centers of excellence where the treatment, it really does make a difference. And so we are thinking critically about what might happen during the time that they are away from effective treatments and therapies, and what that looks like for us to make sure that we are able to bring them back into a system where their care is appropriately provided for, but more importantly, whatever conditions they have or is stabilized. We want to make sure as a payer that we get that under control, keep those costs down, but more importantly, improve their quality of life overall.
Thanks for
I'm
that.
really fascinated by this. How do these individuals obtain insurance or coverage? And usually it's so tightly linked to employment. You know,
Yeah.
incarceration is not a favorable thing for employment. So how do you pass through those hurdles and help them maintain insurance coverage so they can get the treatment they need?
So there are two things. First off, if you are incarcerated and just jail pre-trial, you don't lose your benefits. And we want to make sure that individuals know that just because you are arrested, that does not mean you lose your benefits. You're not taken off the Medicaid rolls. That might be some misinformation that might get passed around, but we want to make sure that they do know they don't lose their benefits. Second, if you are being released in the first 90 days, your first 90 days of pre-release, the Department of Corrections starts taking you through the reentry process, and insurance is one of those opportunities where you can actually select a plan and get enrolled. Now, we know that there are a lot of things that they are actually being exposed to, such as work opportunities, getting set up for, say, addiction treatment clinics and things of that sort. So we do want to make sure that we find a way to work with the Department of Correction to prioritize, enrollment into Medicaid. And so that is something we're currently working on. But that is an option for anyone that is returning to the community, that they can enroll in benefits within that first 90 days of pre-release.
Yeah.
Thank you for that.
I really,
Congressman Davis, I was just getting ready to call on you, sir.
Well, let me just tell you, all of this is so concrete and so relevant because I was just thinking in the last 2 years, I've had 2 male staffers make their transition. That is, they both died in the last 2 years. I've got 2 male staffers right now. One has lung issues, and the other one has pneumonia right now, today. Of course, your medical conditions and all that kind of stuff are private. But I only mention that in terms of saying this is not some mythical stuff that we're talking about. And the guy who's got a lung problem never smoked.
That's right.
I was talking to him the other day, and he maintains that he's never smoked a cigarette, never smoked a cigar, and never smoked a pipe.
Wow.
But he has it.
yeah.
State of Illinois, quite honestly, and I said this the other day when the governor was in Washington testifying, and I had a chance to ask him a question. And I asked him and commended he and the state legislature because Illinois is one of the more progressive states in the United States of America. It has a better handle on dealing with some of its social, medical issues and concerns than a whole bunch of other states. And that's not to suggest that we're not still in need of change, that we still, but I commend the Illinois Department of Corrections because we work very closely with them in many ways. Matter of fact, on Saturday morning,
Mm-hmm.
I'm going to leave from right out here. We're taking 2 bus loads of kids and their female counterparts, mothers and grandmothers, to visit their fathers who are in the Sheridan
Oh,
Correctional
wow.
Facility. We've been doing that now for about 10 years. And men are going to be outside all day right here, even while some of us will be gone. We'll get back in time for the late afternoon portion of what's taking place, talking about manhood and health and well-being and social development activity and what boys need to see
Mhm.
as they move towards manhood. And while we don't necessarily have all of the answers to all the problems and all the needs, I find myself doing some of the things that my father did
Mm.
because I saw him do it.
Yeah.
I don't like trying to drink that cod liver oil that he used to drink. But he only went in the hospital twice in his life. But he'd get him a shot of that cod liver oil every morning.
That's the Arkansas rule, right, Congressman Davis?
I
And
don't know where he
gentlemen,
got it from,
uh,
but
and I'm
he did it, and I think the point is that yeah, we're moving and we're improving and we're getting better and we're doing more. And a part of the reason is the partnerships that have evolved and are being put together and are in fact in existence. I was delighted to hear you, Mr. Trotter, mention foster children.
Mhm.
That's a big piece of my work.
Mm.
Yes.
I'm the ranking member of the subcommittee in the Ways and Means Committee that has jurisdiction over activities dealing with foster children,
Wow.
period, in the country. And we've been able to do some very good bipartisan work related to this population group. So no matter what is going on, action drives policy, and policy creates opportunity for action. And we have a civilized way of doing it, although we are experiencing some traumatic things in our country.
Mhm.
And I want to thank the Chicago policeman who's sitting outside my door right now, uh, because the law enforcement people are protecting
That's right.
members of Congress, especially in states that are close to Minnesota.
Mhm.
Yep.
I didn't even ask them. They called me up and said, "We're going to be outside your office. We got a
Wow.
car out in front of your house." And this was last night and all. So I appreciate them,
Yes.
want to thank them. But this question that I have really is, how does health fit, especially behavior
Hmm.
health, fit into the thinking that some of
Yes.
our people in this country are experiencing right now? And is the medical profession equipped to handle it and move the needle on it? How does the medical profession help to do that?
Thank you, Congressman. That is an amazing question, and I let Nikki know I have to depart early, but one of the things we provide, Congressman, at Miles Square is integrated behavioral health. And so, for example, this conversation we're going to have on this Friday, on June 20th, at 839 West 79th Street from 11 a.m. to 1:30 p.m., we're going to be talking about a big piece of the care coordination model is exactly what the Congressman said around behavioral health, making sure that we have licensed clinical social workers we even do walk-in appointments, Congressman, to be able to address this. And one of the things we want to take away from this conversation on Friday is how do we ensure that we have a behavioral health team that is well equipped to address these behavioral health needs. So, Sean, I know they'll be in good hands with the rest of the conversation, and thank you all for this opportunity. And apologies, I have to leave early tonight.
Well, thank you, and thank you so much for what you do and what you provide. And we're just delighted that you're with us. So
Thank you, sir. All right, gentlemen.
Okay. Well, now one of the things that Mr. Trotter, that I was really impressed, and because that's a big concern, is that a lot of time we have ideas, but we don't have all the partners working together to address the ideas, and the pair is a huge part of this, because there's not that much that you're going to get for free. Most things somebody got to pay for, and as I've been practicing. I practiced for a long time, and started in a time when getting things paid for was a bigger problem than I think actually today, in a different kind of way. Some of it was that people who needed care, and actually some were eligible for health care insurance, but they didn't know how to assess it, and didn't know how to be able to get what they need, and that was a problem. I found that in the justice population, as well as just in the community population. There are a lot of folks just don't know how do I go and get this. I heard somebody tell me that I need to get a colonoscopy, but I don't know how to do that. And so we look at it, and maybe those of us that have been have had the exposure and the training, don't see why that should be that complex. But sometimes people's lives are not really involved, and it doesn't evolve exactly like ours. And so those are not necessarily things that are on their mind most of the time. They're dealing with other issues. And and again, if you do happen to have mental health issues, sometimes that in itself interferes with one ability to access these kinds of treatments, as well as to cooperate with some of these things. So I'm happy to know that the insurers are really really paying that attention to that, but more than that, actually working on getting those things paid for, getting people organized so that they get that care. Because my thing is this: I think that there's a saying that an ounce of prevention is worth a pound of cure, and I believe that if we catch and treat disease and treat people before they get diseases, that we could prevent a lot of diseases. And I think that if we're talking about lowering the cost of healthcare, that's really the way that we're going to have to ultimately do. I mean, we're going to have to ultimately get people to eat healthy, to live healthy, to recognize what it is that cause problems in their lives, and try to make certain that those things are taking place as well as they can. And because without that, a person's going to get sick. And obviously, when people get advanced diseases and they require hospital, now the cost just balloons, and it is much more than what it would have been to take care. I remember when I was doing my residency, and I had this project, and the project was to research the cost of the care of a person who had hypertension. And so now, when I first started looking at it, I'm just thinking about the medical, the healthcare cost of, what does medicine cost? How much is the doctor's cost? But then there's the other part, living. If that person has hypertension, they're going to have a stroke. Now they can't take care of their families. All of this will feed into the cost of what happens if that person if the hypertension wasn't managed in a way that it didn't prevent some of these other in-organ diseases. So it's so important that people are able to receive it, and that those that are in charge really seek those individuals out and try to help them and put them on the right road.
Yeah, thank you for that. I think one clear lesson that we on the payer side, came to the realization was during the COVID lockdowns, we essentially saw one a lot of shifts happen in the discussions that really did first elevate the discussions around the social determinants of health, that really put us in a position to start looking at all those key drivers of what impacts an individual's health. And so we became very attuned and deliberate to, one, listening to our members, but then also following a lot of the evidence that started being produced from that. In addition to that, with a lot of the developments from the Affordable Care Act, the exchanges and things of that sort, it really did shift the payer into a different area of thinking about prevention primarily as being one of those key cost drivers that we, again, took what was out there and started applying it to a lot of our practices and began to actually see that it was a good strategy to work on the front end or upstream as opposed to just, waiting until. Especially when we do start looking at key vulnerable populations, such as those returning from incarceration. What we do know is that this is a population who could easily end up homeless, have chronic conditions that need immediate management. However, the transition might lead to them not getting their medications filled on time, or they might be depending on what it is, if they have behavioral health issues and chronic conditions, polypharmacy becomes an issue. Like, how do we manage all that? And so we're looking at it from all of these various angles and trying to ensure that first and foremost, that when you get coverage, you understand the navigation to care.
Mm-hmm.
Second, that, coverage is available to you and you do not get discriminated against because you have a justice involved background.
Mm-hmm.
We also know that there are certain communities that are just disproportionately engaged with law enforcement. And so therefore we cannot punish them because of environmental policies and practices that target them.
Mm-hmm.
As of such, we need to be aware that, yes, if you meet a certain profile, say a young Black male, there is a higher likelihood that you will have an engagement with a police officer than other individuals in the community. That does not mean that you automatically get dropped if you have, a condition that needs management in the healthcare system. We don't want the healthcare system to become a vehicle that further pushes people to the fringes and leaves them on the outskirts of society. We want to find ways to bring people in, continue to manage a quality of life that they deserve, and more importantly, if there are conditions that they currently have or are at risk of, we catch it early and we manage it and sustain it. We have care managers, our whole teams right now. We're building teams to be deliberate about prevention, mental health, and substance abuse strategies.
Mm-hmm.
We are even prioritizing issues of housing, food security, transportation needs, medical respite, just that transition and hopefully keep you from becoming homeless. All of that is what we as on the payer side are looking at, because we do want the community to be healthy. We want our members to be as whole as they possibly can. And more importantly, that the strain on the healthcare system is lessened, that doctors are not overburdened with conditions that are just at their late stages or having to overuse too many resources that are very costly, leaving people who unfortunately have to face bankruptcy at the worst end of the spectrum. So again, we are deliberate about targeting communities that we know have high risk for hypertension, diabetes, homelessness, behavioral health. Most of them will end up possibly being Medicaid eligible, and we want them to know that if they're Medicaid eligible, how to enroll. And so we do assist, we don't, meaning not us, but the Health and Family Services does provide individuals to help them go through the documentation and learn more about what the benefits look like and how they can enroll. But more importantly, that anyone who is justice involved, that they understand that they do qualify for benefits.
Great, great. Now, one of the other things we often talk about on this in this form is when we start talking about health is again talking about prevention. We often talk about the things that people eat, and we as we talk about it, even people that has not, I think that our society is affected and trained to and encouraged to consume things that are not healthy for them, things that create issues with their health as they move along in life. So he's given that even when you don't, you're not really restricted by your ability to have access. You have access. You have means, and there's still a problem. So if you're now restricted by access and you don't, in other words, if you're in a food delta and there's certain kinds of food that is difficult for you to get, and the cost, you don't have the necessary finance to pay for these things, now it becomes an even larger problem. And so I always look at it and I say it really doesn't make any difference about the size of the problem. Ultimately, if we don't take care of it, we don't do something to lessen it, it's going to hurt somebody, and it's going to cause problem. And not is it going to hurt somebody, it's going to hurt each of us in the way that if we're taxpayers, ultimately somebody got to pay the bill. Like I said, there's nothing really going to be for free. Somebody has to pay the bill. So when we look at those kinds of things, we have to, I'm sure you all know this very well, that you got to look at what is going to cost me if I do this, what is going to cost me if I do that, what is going to cost me if I don't do anything. Because ultimately, without people getting, the kinds of nutrition that they need, then their body's going to suffer somewhere, and eventually it's going to lead to a health issue and damaged organ systems. So in terms of that, are these things that also you all, the payer group, now beginning to look at? Because, like I said, it is a huge problem. I mean, that's outside of some of the things that you can control. It's not all about the money. Sometimes it's really about the education. If I educated them, when I say education, am I teaching people what they need to eat and what they need to avoid? I mean, these are all parts of the problem.
Well,
Yeah, very, very good question. I think for us, we create a omni-channel platform, if you will, of ways in which to actually educate our members, and that even the platforms that we provide are kind of open to the public. They're more than welcome to come to like our main website and look at what are some of the food strategies that we provide, which include healthy ingredients and things that we encourage, not just our members, but any community to consider, because diet, as we know, has a very important effect on how our overall health, eventually turns out.
Yeah.
Even with that, for individuals on our plans who might get diagnosed with hypertension, diabetes, or even with us being a Medicaid program, a lot of our members are pregnant women on TANF, and there might be dietary needs that they might have going both during their pregnancy and even afterwards. And so we do have programs that will allow for, if diagnosed by a nutritionist and a physician, you can actually get medically tailored meals delivered straight to you. So we try to alleviate some of the challenges, say if you live in a food desert, by having food delivered directly to you based on the medical model that will help you through your condition. In addition to that, we, of course, being a plan who is watching and listening and even collecting screening data on our members, like they can go and into a member portal and select whether or not they have food security challenges and things of that sort, for which one of our case managers can then identify resources within their zip code and then make that connection for the member to that facility to help them actually access hopefully quality food that actually does help with their condition. if they also opt into care management with our teams, and then they can actually work with someone that can help identify not just the food boxes that we can deliver to them, but then other resources to help them navigate both healthcare resources, community-based organizations that can, really help reduce any burdens, as well as, just whatever other issues might come about. And that could be clothing for their kids. We can help with that. There are just so many opportunities that we as the payer side take a very strategic look at to try to help community and members be as healthy as possible, because we understand, again, those social determinants of health and those health related social needs are the drivers that we know can easily lead someone into the emergency room. And so we want to find as many ways possible to keep them healthy, keep them in their community, and let them know that we are a resource that's on their side. And that's an important message that I think a lot of people don't necessarily think of when they think of a payer. But yes, we do think about our members and how we make their access to care and how they navigate the system as easy as we possibly can.
Yeah, that is so important. Like you say, people must be able to, have trust and have confidence your plans and what you're doing is for their help, for their good, and that is helpful for them. So they have to have that kind of trust. And then the other side of it is that then they need to be able to trust enough to follow it. As they say, you can take the horse to the water, but you can't always make him drink. The horse got to be able to, if he trusts his master, then he's more likely to go ahead and do what he really needs to do. But so yeah, those are all. As you were speaking about that, I mean, I was just listening. You say even with clothing, and we sometimes don't really. We just think about it just in terms of what clothes are supposed to do, but it has other kinds of effect. Kids get bullied, kids get picked on, kids get that affects them psychologically when they're wearing certain kinds of clothes that maybe not so much in style or those kinds of things. But we might not necessarily look at how important that is, but it does play. It can have an important part in terms of how this kid grow up and what type of things that they a problem that they develop and an attitude that they develop about life and about people.
Yeah, and I think that that's a very important piece to all of this, that when we are attempting to really have insurance recognize the humanity of the communities that we serve. It is something that I know is probably not the story that people typically hear about insurance companies. It probably is not necessarily even the reputation that I can say maybe past strategies in insurance weren't concerned about. Mm-hmm. Me, as a chief health equity officer at Aetna Better Health, I can assure you that what I am thinking about is how the communities in the state of Illinois, whether that is in the high dense urban areas or our rural partners all the way down at the southern tip, our members exist across the state, and we want to ensure that wherever they are and whatever resources they are that are available to them, we can help them get a pathway to it. And that biggest thing that we truly want is that if there is a opportunity to make you whole and healthy, that we do it. And that whole and healthy, like you just mentioned, could be just an opportunity to have some clean clothes. It might be helping you make an agreement with your landlord so that you can stay in your home. That's what insurance does today. We work in between that space, unlike ever before, to ensure that members and community continue to be sustained and are stable and healthy.
Yeah, I know, Doug. I think you retired around the same time that I did. Were you aware of these kinds of things that existed during your years of practice?
It's been really astonishing to hear from Sean and hear about this development, but it does make a lot of sense. It's just like what you're saying, Dr. Miller. An ounce of prevention is worth a pound of cure. We just don't have infinite resources to keep putting out the fires that we could have prevented before they got started.
Yeah.
So it's in everybody's best interest. Not only that, a healthy population is a productive population. So we will not see the same amount of violence and other things we see when people are healthy and fully engaged.
Absolutely.
So it's just,
Absolutely.
I wish more people could hear this and have the understanding that the insurance company is more than just a bill and a check, a lot more than just that.
Yeah.
Well, this is simply outstanding. But I know you guys hate when I say this. It's our time. I want to say hey to Connie Taylor. She's here and she's saying good evening to everyone. And there are tons of people who said, don't forget our questions from last week. I got you. Next week, we promise we're going to get you next week with those questions. I still have them. I have those questions. But as we always say, your until next Mondays, what are your thoughts until next Monday? What do you want to leave the viewers and the listeners with until next Monday? Well, Dr. Miller, what's your until next Monday?
Well, this conversation, it brought me some. I learned something that I was not aware of, and so until next Monday. If you're trying to get in, knock, and the door shall be open. Seek, and you shall find. Sometimes you have to work a little harder to find what it is that you need. Sometimes everything is not going to always be at your fingertips. Sometimes you gotta seek. Sometimes you gotta ask. And so to our community, we say, ask. If you can't find it, ask. Don't be ashamed to ask for help.
That's right. The only question is a dumb question is the question you did not ask. All right. Well, Doug, Dr. Miller says, seek and you shall find. What's your until next Monday?
Well, I just have a couple things to say. And one, Nikki, thank you so much for the work that you did. But I want to share with the audience my experience working in Representative Davis's office. He had a whole staff of people who worked exactly the way Nikki did, helping his constituents solve problems that they had. I can't tell you how many people with student loans who had problems who contact the office had help through Representative Davis's staff. So there are many people in the office that help. They just don't end up on the news. But understand your constituents are being helped quite a bit. Number two, what really struck me about this is how necessary and valuable continuity of care is. Sean's talking about, we want to make sure if you start something, you're able to continue it as you go through the transitions. Because if we don't continue it, you reset and you get back to where you were or worse. So the best way to preserve those things is the continuity of care. So that's my about next week.
Outstanding. Well, Sean, what do you want to leave the viewers to until next Monday? Because you've got to come back.
Oh, well, first off, I'm honored for the invite to actually come back. And I can promise you that there will be no shortage of a discussion that I can have. I think, again, this opportunity just to raise some awareness about I'm going to call it the payer 2.0, because I think, again, we're going through some opportunities, as Congressman mentioned at the beginning, what some of the financial threats will look like for the insurance company, but then to also understand that what the benefits are when insurance company is actually able to come to the table and be a creative and active partner to address social determinants of health. And that's what we want to do. So I'm looking forward to another invite. This has been outstanding. And thank you all for this.
All right. Well, just want to remind you guys of our Father's Day initiative on this weekend. Please come by our office, 2813 through 15 West 5th Avenue. Come and have a great time, learn great things, and just come and grab the resources that are there and available for you. Well, Congressman, as always, take us home.
Well, I can't end the evening without thinking about the millions of people over the weekend. Absolutely millions were out on the streets demonstrating, and all that they were really saying is that they were expressing themselves in terms of what they believe. And they believe that our country this country does not like the idea of anyone acting as if they were kings,
Mhm.
that we reject that notion, and that democracy really means that a lot of input goes into decision making. And as long as you've had your say, as long as you've made your pitch, even if things don't come out the way you want them to come out, you feel a level of satisfaction
Mhm.
because you've had an opportunity. And we have to be careful because there are elements trying to change the way we think about these things.
Mhm.
I can recall when it was not thought that patients had as much to say about their health care as we've now come to believe that patients do have something to say and something to add. And change is constantly occurring. I can remember that no health legislation was passed in this country except the American Medical Association approved of it.
Mm.
I'm saying if it was not approved by the AMA, it was not going to happen.
Yeah.
Now there are bunches of elements involved on everything that comes into being. And that these partnerships, when you put task, task is an entity created by the Illinois legislature. Uh, in the event that some people may not know what task, treatment alternatives for safer communities, or other entities that were created and are a part of the health decision making apparatuses that exist. And when people have the opportunity to express themselves, there's no telling what you may come up with.
Mhm.
But if they don't,
Mm.
then you may miss the main ingredients that you need in order to make something work. So let me commend all of us for the role that you play. And we're not finished yet. I mean, there are still some hills to climb. There are still some decisions to get made. There are still some findings that we have not realized. But if we keep moving in the direction, we ultimately reach the point, and I think it's pretty simple. I always say if you want to go south, just turn and face that direction. And every time you make a step, you get a little bit closer to 95th Street. But if you're heading up towards Evanston, chances are pretty good you'll never get to South Bend. so so let's just keep moving, keep searching, keep realizing, and ultimately we'll get there. It's coming. So thanks to all. Have a good evening, and we'll see you next week. All right.